for joining us. My name is Mary Yanez, and I am the director of the Senior Adult Program at the El Paso Community College. And as you can see, this is Mature Living. This is a show that specializes in bringing you information for the community, for families, topics of interest. And right now, the hot topic is voting rights and voting. So we want to introduce you to a couple of guests, and I believe it's their first time that you've been here on Mature Living. And I want to introduce Dianna Carter, who is the immediate past president of the organization that you represent, the El Paso Council of the Blind. And also, you've brought with you, thank you for being here, Dianna.
Thank you for having us.
And with you is Eleanor Coldwell, and she is a board member, one of the board of directors. And I understand, welcome both of you.
Thank you.
I understand that your organization is about 5 years old. Tell me a little bit about yourself first, and then we'll talk about the organization.
Sure, thank you. And so as you mentioned, my name is Dianna Carter, and I have been a member of the El Paso Council of the Blind since its beginning, 5 years ago now. And I served as a board of director on the first year and served as president for the subsequent 2 years. I am currently the immediate past president and also serve as the chapter representative to the American Council of the Blind of Texas at the state level.
That's very interesting because that's probably going to take a good chunk of your time, your volunteer time, because I'm sure you all are volunteers. Tell me a little bit about when you lost your sight.
Sure. We learned later as adults that my parents both had a recessive gene for retinitis pigmentosa. I also have 2 other brothers who have lost their eyesight as well. And this is a hereditary condition that affects most people in their adult life, usually high school age and forward.
Yes. And how old were you?
I was about 24 years old when I was diagnosed. Yes.
Well, that's very interesting, and I know why your passion is where it is. Eleanor, tell me a little bit about your situation with your sight.
I have macular degeneration, and I was diagnosed approximately 10 years ago, and I lost my vision gradually. I now am really struggling trying to see as best I can. And so I became a member of the El Paso Council of the Blind a little over a year ago because I was searching for some help and some support. And from the first moment I walked into their meeting, I felt very welcomed and just emotionally strengthened by the El Paso Council of the Blind. And so I became a very active member.
That is so great. And I know someone that has that same disease, and I know she would be very interested to find out about how she can join your organization. And that's what I would like. The purpose of this interview, of having you as guests, and thank you for calling Mature Living and helping us to help you and all the people that you help. We want to sensitize people. We want to stimulate people to join. You don't have to be blind to join this organization. There's family members. There's, you can just have, if you don't have anything to do, hey, come and volunteer. I'm sure you have events that are coming up. Let's talk a little bit about voting rights for persons with vision issues. Tell me about that topic. How do people vote? And I'm going to ask Dianna to start with that one.
Sure, thank you. So prior to the Help Americans Vote Act of 2002, when a person that was visually impaired or blind went to vote, most of the time the extent of assistance was that a polling employee would read the ballot to them or have a family member read the ballot to them.
So there was no privacy.
There was no privacy in the voting, and you had to trust that the person assisting you was casting the vote that you actually wanted.
That's right.
And so after the Help Americans Vote Act, that actually mandated that all polling places provide accessible voting machines. And this gave visually impaired and blind persons, as well as low vision persons, the ability to vote on their own independently.
Yes.
And so that tremendously impacted how persons with any visual needs cast their vote.
That is so interesting. And Eleanor, you brought a device. You brought something to show us. Can you pick up the what is this?
This is called the
Technology.
audible voting ballot, and it's got the external keypad that helps you to vote. Excuse me, and it's connected to the voting machine.
Yes.
And it also comes with a set of earphones that you can use. Well, you have to use the earphones to listen to the instructions,
Yes.
which you can replay, by the way, if you want them repeated. And the external keypad allows you to move forward in the ballot, or allows you to move back, or to delete. It will read to you what your vote was. And if you find that you've made a mistake, you can go back, delete it, and re-vote. So it's very step by step. It's very simple to use.
Yes.
And
Every voting place will have this device available.
Yes.
And so when you come in with, whoever's escorting you, whether it's a dog, guide dog, or a family member, you just have to say that, and they'll take you to the place where this is available.
yes, when you walk up to hand over your identification card or your voter registration card, you can request right then to have an accessible device. But this is not the only thing that we can use.
Yes.
This is an audible device, but then there are also 3 other ways to vote. You can vote on a paper ballot, which is a large print.
Yes.
Then also on the machine itself, you can control the magnification of the letters on the screen. And then you can also control the contrast. So if you want light letters on a dark background, maybe that's easier for you to read.
Yes.
You can do that. Or use a light background with dark letters. And you can
Change that before you start to voting. 8 minutes go so fast on television, but I do want to mention, you went to a conference real quick, and what are some of the statistics that you've learned about El Paso, and how many sightless persons are here? And then we're going to give the phone numbers, by the way. I'm sorry, Dianna.
Oh, I also wanted to mention that the accessible voting with the keypad and magnification and color contrast are all available with early voting as well.
Okay, very good. Give us your phone number, Dianna and Eleanor. So important, because we've just touched, we've just touched the very surface of this topic. And I know people will want to either join your organization or ask you more questions, by phone, so that we can continue this stimulating and interesting topic. Give us your phone number.
Thank you.
Dianna and Eleanor.
Thank you. And we have a great group, and like as you mentioned, it is for persons going through vision loss as well as their families. And my number is 915-539-6919.
Okay,
and
Eleanor.
my number is 915-479-4338.
And I understand you have a Facebook. Who wants to tackle that one, the Facebook? How do we find you?
Yes, please friend us. We are listed as El Paso Council of the Blind, and we will be happy to hear from you and definitely respond to any messages you send us, or just simply like us and follow us.
Very good. Eleanor, any last thoughts?
We're always looking for new members, so if anyone would like some support or would like to come and help us out, we're a hardworking group, but we're a fun group. And so if they'd like to join us, just give us a call.
I think Mature Living should be a member. We can join you. Okay, come back and visit us soon. Thank you for staying with us. There are so many ways to receive medical services these days, and sometimes we think, well, how else can the patient receive the services that they need from their doctor. And so we met recently, Larry Garcia, and we talked to him on the phone, and he was talking to us about New Light Primary Care, private practice. Dr. Manquero-Butler is here with us to talk a little bit about her practice and how that she's serving the community, in particular seniors, I'm sure. Thank you, Dr. Butler, for being with us. I'd like to get to know you a little bit. Can you share a little bit about your practice and your school?
Yes, well, I'm a native El Paso, okay. We were back and forth from Juarez and El Paso area. I finished my medical school in Juarez, Mexico. I did my internship and all the residency training here in Texas Tech, okay, in the family medicine department. And we trained with geriatrics. That was the main focus on this residency training here in El Paso. And that's what really got me into joining this program. So from there, in 2002, graduated and joined BMB Senior Health Services for 8 years. After that, in 2010, I started my private practice. And we've been doing pretty much the same, geriatrics, frail citizens. In 2010, well, actually, about 2 years ago, we started doing more house calls. We've been doing house calls.
That's the interesting part of getting to know you, Dr. Manquero, is that you go to the homes, you do home visits.
We do house calls, home visits.
Tell me about how that's going and why is it so important sometimes to have a doctor come to the patient?
Yeah, well, I think it was there has been more attention paid to this type of population because of the healthcare, the way we're spending money. These patients usually cannot get to the doctor, so they go and use the hospital or the emergency room as their primary care, and they just go back and forth. So, primarily we focus on serving this type of patients. Many patients don't know that these services are available, are fully covered by Medicare if they have the requirements of homebound. So we can go and serve these patients and do primary care, all the preventive and medications, coordinate their needs.
And even coordinate their lab exams there and x-rays or whatever it is that they need. It's very interesting because that kind of goes with seeing how the patient is coming along. If the medication needs to be changed, it's got to be the labs are important.
And you see the home environment, the dynamics that plays a lot into, how they're being cared for. So, and we're very excited. We're growing, daily because there's a lot of need. There's thousands of patients here in El Paso, that are homebound, literally either wheelchair bound or bed bound. And they have no care. So they just get sick, go to the hospital, and goes back and forth.
And in talking to Mr. Garcia, when we talked on the phone, said, "Oh, the doctor makes home visits," and that kind of like, well, talk to Claire because I want to bring the doctor to Mature Living to share about your practice. So you're the marketing director for the practice, the New Light Primary Care. Tell me about what you're doing.
Well, what I'm trying to do is it's very gratifying. What I do is when you start talking about what we do and the services that we bring, there's always, I know somebody. I know who. I have somebody. And there's a big need out there. So to me, as a marketing director for Dr. Manquero-Butler and New Light Primary Care, it's just trying to get the information to the people that need it, okay? Not only the people, but the adult children that are making decisions for these people. The adult children that are having problem placing these patients in a car, sitting with them, taking care of them, getting out of work for a whole day to take them. And most of the time they sit there for about 5 minutes. I mean, they sit there for hours and they be they
And they're
only
seen
have
for 5 minutes.
5 minutes.
And it's very stressful.
Yes.
And you know, and Dr. Manquero mentioned the dynamics, the family dynamics. When you go to the home, you can also talk to the family members at the same time and have them there in the comfort of the patient's home and find out what more that you can do to help the patient. I noticed you also accept the at-risk hospital and
Yes.
readmission patients. And how did you think about this? And I know your offices are growing. You'll probably have some offices that will be open for patients to come to you, but then also you're going to be able
That's
to go.
our primary focus.
Yeah, yes.
That type of practice. Yeah.
So how gratifying is that,
Oh,
Doctor?
it is very gratifying. You know, when you see that you are fulfilling a need, you know, and that that we're making a difference in people's lives. I mean, it's absolutely gratifying.
Yes, and it's good to have a local person, a local doctor to see that knows El Paso and knows our culture, our cultura. So important as well.
Yes.
We wish you great success with your private practice. If there's anything else you'd like to add to our interview.
Well, I mean, I hope this is a means for people to know that we're available for whatever needs they have. We also serve patients that are probably won't be qualified as homebound, but we have a lot of patients with psychiatric needs that cannot be sitting in a doctor's office or,
Yes.
you know, because of whatever the problem might be. So we're also seeing patients that have problems with psychiatric problems. We have a psychiatric nurse practitioner that is helping us and a psychiatrist that is also on board.
Yes.
So we're expanding our services. We have podiatry on board. We
Very
have
important for the seniors.
yes, dentist. We have dental. We're working on ear, you know, hearing doctor. We're working on different things to bring to
We
the
have
homes.
a mobile X-ray unit that goes
The
to their
X-ray.
home, and actually it has New Light Primary Care. We have mobile labs that go in there, so we making it easier for these patients to be seen and kept out of the emergency rooms.
It's exactly the
That's the
expensive
whole thing.
part of it.
Yeah, yeah, and you know, we're trying to also decrease the burden on you know our government. You know, I mean,
The
Medicare
burden,
was also going bankrupt.
Yes.
So you know, if we coordinate services, we can really have a better healthcare here in our country.
What is your first name, by the way?
Martha.
Martha. Dr. Martha Manquero-Butler.
Yes.
We'll have to remember that, right? And so thank you for coming to Mature Living. We hope your practice goes very well. A phone number, is there a phone number? We can
Yes, there's 772-5400, and we will gladly answer any questions. We also have a website. It's under newlightprimarycare.com. And if you go there, you can see all the information. You even have a tab in there that you can refer patients.
Very
I mean, we do electronically.
Thank you so much, and we
Thank
wish you
you.
great success.
Thank you so
and
much
thank you
for
for taking
having
care of
us.
our elders,
No,
our
thank
seniors.
you.
So important.
Thank
We'll
you.
be back with more Mature Living. Every once in a while, we invite great friends of Mature Living, and not only great, but very, very informative. And we've invited Bob Warach, who's an attorney. He's got his practice here in El Paso, does a great job in assisting people to educate us, in particular about, let me see if I can get this right, wills, powers of attorney, guardianship, and physician's directives. Maybe I
Exactly.
didn't get them in
No,
the right
that's
order.
perfect.
Okay, Bob, you have hosted our show whenever I'm off, you know, on a vacation or something, and you've also done some special segments to talk about legal documents. Tell us a little bit about these topics right now, and then later on we're going to invite you back so that you can talk about real estate.
All right.
So
I'm glad you said I'm a friend of the program, because
Yeah,
I feel that way.
you're part of the family.
Thank you, thank you. You know, wills are not a top priority for people. People keep putting them off. It's associated with death, not a happy thing, but it's something that shouldn't be delayed for any number of reasons. It's just very important to have a will. If you have a will, you can direct to whom you want your property to go, to your kids, to your husbands, wife, brothers, sisters, whoever you want.
Yes.
If you don't have a will, the laws of intestacy, that means an intestate is a person who dies without a will.
Yes.
And the state laws regarding intestacy will determine who gets your property. So conceivably, it could go to, if you have no close relatives, it could go to a cousin twice removed who you haven't seen in 20 years and might not even like.
Yes.
But that's who's going to wind up with your property. There are other reasons that you should have a will to protect your loved ones. So, for example, let's say you have a disabled child and they're getting public benefits, they're getting Medicaid. If that child inherits from you, which they would if you die without a will, they will lose their public benefits.
That's right.
Well, you don't want that to happen, correct?
Yes.
It could go, your property could go to a minor child, an 8-year-old, and then you'd have to get into a guardianship.
Yes.
It could cost more in attorney's fees to probate your estate if you don't have a will.
Yes.
So
There are many reasons.
for all, yeah, many reasons, and that's not all
And
of them.
also the pains and the fighting and the whatever that happens sometimes in families if there's no will.
Exactly.
And so you save that hardship.
Yes, you do.
Yes.
Because you're making the decisions before you die. And when we talk
Yes.
about directed to physicians,
Oh.
actually, let's just segue into that for a minute.
right.
Because that really causes difficulties. A directed to physician is essentially a document that tells your family and the doctors how you want to die. Do you want to be put on a breathing machine? Do you want to have a tube put in your body to be fed? Or do you want to be allowed to pass away kind of in a hospice situation where you're kept comfortable and not in pain and you're not treated, but you're allowed to die? Well, I can't tell you the number of times I have kids sitting in front of me who get into these terrible arguments. I'm going to keep my mother alive no matter what, and I'm going to hook her up to machines and this and that. And the other ones might say, but Mom told us she didn't want that. Well, I don't see anything in writing. It's not in writing. And those are terrible arguments to have.
Yes.
So people don't realize how important that document is, because it says exactly how you want to be treated when you're basically actively dying.
Yes.
And really, the document says if a physician determines that you have a terminal condition and most likely will pass away in 6 months, then you can sign this document that says exactly what you want done or what you don't want done, which is
Very,
probably
very
even more important. Yes.
And so we want to also talk about powers of attorney and guardianship.
Right.
How do we address those?
Well, the will, I have to back up a little bit. The will is effective only when you die, and it's kind of a two-pronged thing, only when a judge declares that it's a valid will. So you can't just say, oh, look, I'm executor in this will, I'm going to act. You have to be appointed by the judge to act.
Yes.
Or you can't just say, look, this will says I get my dad's house. Not until the judge admits it to probate. And people tend to be afraid of probate. They think it's going to cost a lot of money. They think it's going to take forever. And we're really fortunate in the respect that Texas has a very expedited and efficient probate process. So look, anytime you go to a lawyer, it's going to cost money, but it's nothing like it would cost in California or Florida or Illinois. It's very reasonable.
Yes. So the power of attorney is very important. Who?
Okay, so that's exactly, I'm sorry, I kind of lost my train of thought for a minute. But The reason I wanted to bring that up about a will only being effective when you die, powers of attorney are only effective when you're alive.
Okay.
So here's how they work together. You can sign a power of attorney, and you are called the principal. And the people you name to act for you are called the agents. So let's say I do a power of attorney, and there are two types. And I do a power of attorney, and I name you, Mary Yanez, as my agent to act under my statutory durable power of attorney.
Yeah.
I explain that to people as being a business power of attorney. You could get into my bank account, you can pay my bills, you can make financial decisions, you can make gifts, but also I'm not giving away that power. I can still act until I become incompetent. And then you could continue to act for me. And then when I die, what happens? The will gets probated and you act under the will.
We have about a minute left, but I think we can touch on guardianship a little bit.
Guardianships are where a person is formally appointed to legally act for another. The two most common cases are you're acting as a guardian for a disabled child,
Yes.
or you're acting as a guardian for a disabled parent.
Okay.
You are the natural guardian of your child until they're 18, because that's the age of majority. Once they're 18, if they have a disability, then you need to go to court and be formally appointed their guardian. So you can get medical information, you can go to the bank, you can do whatever you need to do.
And these are all legal documents
These
that
are
are
all
respected by the court.
Respected by the courts, and
And the
then
law.
hopefully respected by third parties.
Yes.
You know, a doctor can't tell you somebody else's medical information unless you have that authorization.
Okay.
Now, you could have a medical power of attorney also, because there are those two types. But guardianships are extremely important procedures, and people need to know about those.
Well, you know, I want you to give your phone number because I know you have a very efficient staff that can also answer all of these questions. Can you give us your phone number over at your office?
I certainly can.
Yes.
It's 779-3619.
Yes, and in another conversation that we're going to have, that we can promote and show and present through Mature Living, would be real estate, because I have some questions about that as well.
Oh, good. I'd like
but
to
we'll
come
be
back and
another
do it.
time.
Yeah.
That'd be great. Okay, Bob Warach, he's a wonderful attorney, a good friend of Mature Living. He's part of this group here. He does shows with us. So thank you for being with us, but we'll see you soon.
Thank you.
Okay, we'll see you all next week.